Hello and welcome to Public Health in Real Life. Today we have the privilege to interview an inspiring person, Dr. Joseph Dumbuya, who is a public health advisor with the US Small Business Administration quarantine section in Washington, D.C. Dr. Dumbuya started his journey in dentistry while working as a translator with a global charity called Mercy Ships in Sierra Leone, West Africa. During the intermittent visits by the charity to Sierra Leone, he was trained as dental assistant and an oral health teacher. During this time, Joseph Dumbuya became passionate about oral health as he saw a big need for oral health care in almost all the African countries that he visited. In 2004, he was offered a scholarship to join over 500 crew members of the Mercy Ship 4-tier hospital, where he worked as a dental assistant and later as an oral health program manager. He led various oral health programs in Ghana, Liberia, and other West African countries, supervising a staff of dentists, dental assistants, and dental hygienists from all over the world while providing free quality dental care for poor and needy. He was also the first African to lead the department in the 48-year-long history of Mercy Ships with over 70 countries represented. Dr. Dumbuya graduated with an integrated master's degree in dentistry, DMD, from the University of Debrecen Medical and Health Science Center in Hungary, Master of Public Health degree from the A.T. Still University of Health Sciences in Missouri, United States, and he is currently pursuing another master's degree in Healthcare Informatics Administration at the University of Maryland Global Campus. Dr. Dumbuya also took certificate courses in oral health care for people with developmental disabilities and in principles and practices of clinical research at the National Institutes of Health, USA. In his free time, he volunteers with the African American Health Program in Montgomery County, an organization that provides low-income families with free healthcare services. In 2018, Dr. Dumbuya partnered with a charity called Enable the Children to provide free dental care for special needs children at the Cottage Hospital in Freetown, Sierra Leone. Dr. Dumbuya is a member of Healthcare Sierra Leone Incorporated, an organization that is focused on improving healthcare in Sierra Leone through volunteerism. Furthermore, he co-founded Shared Blessings Global Outreach Foundations Incorporated with his wife, a foundation dedicated to medical and dental missions where they collaborate with other medical professionals to give free healthcare to underserved communities in Sierra Leone and West Africa. In December 2019, he received an award of excellence for his service to humanity from the Albert Academy Alumni Association, Washington, D.C. chapter. Welcome, Dr. Dumbuya.
Thank you. Thank you, Mr. Osborne.
So this is really inspiring to have you here today, and it's such an impressive story. And I would like to start with your early years. If you can discuss a little bit about what got you associated with Mercy Corps, and also a little bit about where you were born and brought up, and its influence on what you're doing today.
Well, thank you, once again. Like I said earlier, I'm a Sierra Leonean. I was born in Sierra Leone, and I grew up during the time of the Civil War in Sierra Leone. And it was a very difficult period for many of us. I'm from a family of 6, and I lost my dad even at the age of 2. I don't have any memories of him. So my mom was the only breadwinner of the family, so she had to care for us, send us to school. In that part of the world, we don't have, provisions for single parents, in terms of them losing their husbands and then they have children to care for. So we don't have any provisions from the government. So she had to work very hard to send us to school and to care for us. And I'm the first in my family to be able to get a graduate education, and which I'm very very proud of. So in Sierra Leone, the medical situation there is not a good one. Sierra Leone is ranked among the least developed countries in the world, and that has not changed. Compared to other West African countries, as a matter of fact. So growing up in Sierra Leone was a difficult one, and I understand the needs of people in terms of healthcare. So the mentorships, paid a visit to Sierra Leone in 2000, in the year 2000. At the time, we were still going through the Rebel War that lasted for 12 years. It was about coming to an end. So they came into the country, and then through my church, I was able to volunteer my time to serve with the mentorships. So I volunteered as a translator, and then we were able to provide free medical and dental care for the poor and needy people in that region. So that's how I started. That happened in 2000. I mean, the ship came back another time into Sierra Leone in 2002, and I was able to volunteer again. And I gave my time for free. And then through that process, I was able to learn on the job. I was trained on the job to assist the dentist.
Mhm.
And then in 2004, having proved myself to be trustworthy, they offered me a scholarship, to join the crew. And then I was able to sail with the ship. We sailed to different parts of Europe, Southern Africa, and then we were engaged in medical missions, providing free, medical and dental care for the poorest of the poor in West Africa. So then I served with them as a volunteer for almost 4 years, from 2004 to 2008, and then I saw the need in West Africa, in all the countries that we visited, Ghana, Liberia, Sierra Leone, Togo, Benin, all of those places. I saw the need for our healthcare and also medical care as well. So and I was able to lead, field services in Ghana and Liberia. In Liberia, for example, they had only 2 dentists for 2.5 million people at the time when we went there in 2005. So you can imagine that, and in Sierra Leone, I mean, up to today, as I'm speaking, we have about 8 dentists for 8 million people. And also it's a similar situation in terms of ratio when you talk about, physicians and other healthcare workers.
Yeah.
So that was my motivation to go to medical school in Europe to be able to get an education so that I will go back someday and be able to be of help to our people. Because we have to be able to make a difference. We have to be able to, acquire every skills we can. And through policies and advocacy and going there and doing things, so that we can be able to make a difference in the lives of other people. So that's how I get into that. And then, going through that process, and then the Ebola outbreak happened in Sierra Leone. I was in school in Europe at the time. I went home to do some voluntary work also at the government hospital, and then the Ebola outbreak came. And then that also strengthened my, the need for me to be involved in public health, So immediately, but when I finished dental school in Europe, I started to do, I enrolled into the Masters in Public Health program.
That was my next question. So what got you interested from dentistry to public health?
Well, yes. I mean, coming from the Ebola outbreak in Sierra Leone, and then seeing the need to be able to treat population, rather than just, a couple of thousands of people. If I go to Sierra Leone today, I mean, I have a state-of-the-art clinic there, that is set up. I can just treat people and make money, take care of myself and my family.
Right.
So, but I don't want to live, a life just for myself and my family alone. How can I make a difference in the lives of other people? That's the question I ask myself every day. So while in school, I mean, I took a course in community development and in public health. And then I say, I can be able to use epidemiological tools for disease prevention and control.
Absolutely.
And then I'll be able to, to influence, decision making, in terms of policies. Then I say, oh, I mean, I can do something bigger than just dentistry. I mean, dentistry is big, but I can do something that is more, population based. That's when I decided to go for a training in public health. So when I moved to the state, I mean, to join my wife, and then I was able to get into the program, and then that's how I get into public health, and that's the story so far.
Definitely. So, in terms of, I would like to jump into the HR and human resources and global health, and there's such a dearth for dentists in Sierra Leone. Just as you mentioned, there are only 8 dentists and 8 million population. So, could you discuss a little bit about the barriers for people to pursue or even become aware about careers in healthcare as a community within Sierra Leone, to pursue oral health studies or even medicine in particular?
Well, I mean, there are a lot of problems. First and foremost, in Sierra Leone, we don't have any dental schools there. Compared to places like Nigeria, they have, dental schools. They have them in Nigeria, and they have 2 in Ghana, and then there's 1 in Guinea Conakry. I mean, there's 1 in Benin, Cotonou. I mean, these are places that have worked, but we don't have any dental training program in Sierra Leone. There's a medical school there, that train just a limited amount of students annually, but there is no dental program going on right now. So that's a very big problem in terms of workforce. And even all across West Africa, to the countries that have worked, it's a similar situation. Even if they have those schools in those countries, they only train a limited amount of people. And also you have to count the cost of it. How it's very expensive to train, in dentistry, because of the materials that you need to train dentists. They're not readily available in those countries. They don't produce them there. So they always have to import those things. That's how it's a bit different from medicine. But with dentistry, you need materials for every such procedures, ranging from endodontist, to orthodontist, and to postodontist. Everything, you need those materials, and most of the times you have to import them. So it makes it more expensive to train dental surgeons. That's one thing. And then the political will is not there in some of these countries. They treat oral health as something separate from the overall human being. That's how they see it. So that mindset has to change among Africans. That mindset has to change. They see oral health as if it's just head and neck. And where I did my training, that's not the case. We did a lot of the courses again with the general medicine students. When you talk of anatomy and everything, we did the same things. So you're not limited to just the head and neck. So we see the connection there. But I'll get more into that, probably later. But we see the connection there. So the awareness is not there.
Right.
So the people also don't have the awareness of oral health as a result.
Right.
Most people culturally, they don't have the culture of going to see the dentist every 6 months, like we do in this part of the world, or just checkup and regular cleaning. They only go to the dental clinic when they are in pain, like a tooth that needs extraction. Not even one that you can even save by doing a root canal, which can be done most of the times. People will just come visit you and say, you know what, I'm in pain. I just want you to get this tooth extracted. Then we have to educate them to say, no, in this situation, you have other options.
Right.
We can do a root canal to save it, but can they afford to pay for it?
Right.
That's another question, the affordability. is not there as well. I mean, most people, living less than $2 or $3 a day in some of these countries. So they cannot deprive themselves, just to have a dental treatment and then deprive their family of, their daily meal. So the cultural mindset there is that they only come to the dentist when they are in pain.
Sure.
And in my time, working in other places in West Africa, we see people just from a common toothache,
Right.
resulted in some kind of tumor. And then when that also happened, there's also another cultural issue in that. People think that, you've been bewitched. Either
You've
it's
been
out of
witched, okay.
witchcraft.
Right, right.
Probably, you swallow some kind of meat at night, and then the meat, just get your face swollen.
Right.
Your jaws are swollen. So instead of them going to the dental clinic to seek help, they will stay at home and find some kind of traditional medicine to cure their problems.
Right.
All right. And then sometimes the people, because they cannot afford, they cannot access some of these facilities. Like, for example, in Sierra Leone, where there are only 8 dentists, all of them are centralized in the capital city of Freetown, which has just like, probably 1 million people. So the remaining 7 million people are outside of the capital. So they don't have any access to oral care. So they don't even have money to pay transportation to go to the main cities to access any oral care. So there is no workforce there. There is no infrastructure there for them. No clinics for them to visit. So this resorts to other kind of, traditional medicines, whatever they can do to save themselves from the pain. That's what they will do.
Right.
And in most cases also, they sit at home, the situation gets worse. So by the time they're able to make it to the cities to access a professional dental care, and sometimes they even end up losing their lives. Because people end up having infections, they tend to keep it at home for long, it becomes chronic, and then sometimes it spread through their mediastinum, through their heart, infect the heart, and then they die.
Right.
I've seen this. Sometimes people go, they just go somewhere where somebody has like a plier or something, whatever they can use, manually on the roadside, extract the tooth. And then they ended up having this infection because they lack equipment, they lack the right equipment that are not even sterile. And then they use it to extract the tooth and then, get further infections. And then it can lead to death. So these are some of the problems that people face in terms of the culture. And people also, out of fear of going to the dental clinic because of some of those experiences,
Right.
they're fearful. So the culture of fear as well, people don't want to extract their wisdom tooth, for example. They think that they might go deaf or blind if they have a wisdom tooth extracted.
Right.
It will surprise you, but this is how some people think. So they are afraid of going to the dentist because of some of these things. Most people don't like to go to the dentist, but in those places, it leads to death for some of these people.
Right.
And they don't understand what it means. So we have a lot of sensitization to do in developing countries for people to understand the connection, the oral health connection with systemic health, and how it can affect their systemic health. For them to understand that if you don't have good teeth in your mouth, you cannot be able to chew your food properly and get the necessary nutrition for you to grow.
Right.
Especially for children. They will not be able to eat and feed properly. Food will not be able to digest. Digestion starts from the oral cavity, going downwards to the GI tract. So if they don't have access to chewing properly, then it affects their nutritional status. They'll not be able to get the essential vitamins to grow. That's one thing. And if they don't have good smiles, it affects the children also psychologically.
Absolutely. Yeah.
They are bullied in school. They avoid going to school. It affects their self-esteem and all of that, which affect them also educationally and socially. And again, because people don't have the culture of going to dental clinics, even for children, a lot of um, diseases that start in the lives of children, the first place you can diagnose them is from dental visit, because you see that the signs and symptoms are in the oral cavities.
Absolutely.
So that's why even from childhood, it's important that people understand the culture of going to the dental clinic, just
Absolutely.
a regular checkup.
Yeah,
Yeah,
definitely.
yeah. No, you
You
do
know,
raise, uh, sorry. I just wanted to say you've raised very great points, Dr. Dumbaya, about the barriers to access, availability, and affordability of oral healthcare. And I would even like to corroborate your story and say, I grew up in Nigeria, middle class. I trained as a physician, and yet I never visited a dentist. So
mhm,
you've definitely touched on a lot of that awareness, sensitization, cultural practices, and all of those factors that really, like we call it, that we define as social determinants of health,
that's right.
that all interplay to people seeking oral health.
That's
So I
right.
would really want you to expand on that piece about, barriers to access, availability, and affordability of care, and all those factors. The global burden of disease estimates that oral diseases affect about 3.58 billion
Billion.
people worldwide.
Hmm. Hmm.
And of course, we know with, you've mentioned Ebola, now COVID. I'm assuming that that burden has increased significantly.
That's right.
So I think going back to the basics, how would you define oral health to the layperson, somebody who isn't a professional oral health practitioner?
Well, that's an interesting question, because I always try to, um, because again, the other problem that people have, when you think in terms of communicating to grasp with people, is for them to be able to understand what you're saying.
Yeah.
When you talk about oral health, but what the layman's understanding of oral health, you know. So oral health, has to do with your teeth in your mouth, the structures that support the teeth, your gum tissues,
Yeah,
and then also how you can keep those things healthy.
sure.
Your gum tissues, the teeth in your mouth, your tongue, and every area inside of your mouth and then outside of your mouth, how you can keep all of those things healthy,
Sure.
because you need your teeth to smile. If you cannot smile, or you're unable to smile, or you shy away from smiling, it affects you
Psychologically.
psychologically. It affects your self-esteem as a person, especially for women and men as well. So that's why most of the time you find out that women are much more likely to see the dentist than men.
Okay.
You need your teeth in your mouth also to chew food. To be able
Right.
to digest your food properly, you need to chew them properly. So that starts from your oral cavity, it starts from your mouth.
Right.
So you need that. You need your teeth for that. And
Dr.
then
Dumbuya.
also, you need it for your speech.
Yeah.
If you don't have your front teeth, it will be difficult for you to pronounce certain words, certain letters. So you need it also for your speech.
Absolutely. Dr. Dumbuya, earlier you mentioned about fear in the community to access dental health services. But along with fear in the global health community, we all often talk about trust in the healthcare system. Have you experienced people complain about not having trust in the healthcare system, and that is the reason why they don't approach proper health systems for their care?
That's right. Yes, I've experienced that a lot in West Africa,
Sure.
because first and foremost, like in some of these countries, they don't have qualified and trained healthcare professionals, whether in oral health or health in general. The workforce
Sure.
needs to be developed to win to win the trust of the people.
Sure.
And then secondly, the infrastructures has to be developed to win the trust of the people. Again, policies has to be developed that will win the trust of the people. When they know that if you as a medical professional, you do something wrong in terms of clinical care, you will face justice. You will not just walk away with it when you make some certain costly mistakes. You know, because in other parts of the world, like in the US, for example, you have consequences to pay for it.
Yeah.
But people don't trust the systems in some part of the world because they don't see some of these things. And again, supplies, equipment,
right.
They need those logistics. If people don't have enough instrument to work with, they don't even have a sterilization unit, how can they do their work properly? So government policies has to be in place.
Right.
But again, we don't want to just depend all the time on government, because I mean, what I said when I went to Sierra Leone in March, I mean, before the coronavirus pandemic.
Sure.
I went outside of the capital, you know, I mean, one of the communities that we are working. And I just think that we need both private and public sector investment in healthcare.
Sure.
Because when there is private sector investment, also you create competition.
Right.
So we don't just want government all the time. We want to motivate private sector investment.
Absolutely. Because I also read an article that said, you know, when there's resources to buy high-end machineries to mine diamonds in Sierra Leone, then there is enough resources even to ship high-end medical supplies and equipment as well. So I think Maymun also has a related question on this.
Yes, yes, ma'am. Yes.
Yeah, that's actually a very interesting analogy you mentioned, Ashwin, about likening the wherewithal and the system to ship equipment to mine diamonds can also be used, or that infrastructure can also be used to support shipping essential medical equipment.
Yes.
So I think, like Ashwin said, expanding on that piece on health systems, Paul Farmer defines a very simplified framework for health systems where he talks about the 4S model. Well, it has been expanded to 5S, but the 4S's are mainly the space, that's infrastructure, the staff, that's healthcare workers and all the support staff, the systems, like you said, the policies, all of the different systems that would allow for health systems to function, and then stuff, which is essential medicines, equipment, and supplies. So using this very, very simplified framework, and as you've touched on health systems, what do you think are recommendations as to how to improve on oral health and, in turn, just healthcare overall in places like Sierra Leone and West Africa?
Well, first, I mean, like I said, policies. I went to Sierra Leone in March. I mean, like I said earlier, because I'm trying to set up a school-based oral health program, a national program, where we can start from the schools, in terms of preventive oral health care. When I say preventive oral health care, I'm not just talking about brushing, because I mean, that's what people think about most of the time.
Right.
Here in the States and even in Europe, where I studied, we have what we call fiscal sealant application. We bring in the children every 6 months for cleaning. Then we look at when they develop their molars and that their posterior, their back teeth, that they use to chew, we put a coating on them, on some of the, on what we call the fissures, I mean, some depressions you found on the upper surface of the tooth. That's the protective coating from dental caries. We apply that. And another thing also that we do is fluoride application. Because in that part of the world, I mean, for most of those places, the fluoride content in water supplies is not regular. They're not that regulated because most people
Right.
don't have clean drinking water. So because they don't know the content of it, and you need fluoride, for teeth to grow, for prevention from caries and all of that. So we also do that because they put the kids at high caries risk for dental caries. So we apply fluoride varnish on their dentition every 6 months. So I was there because I wanted the government to work with me so that we can put together some policies in place, and then to give me the kind of support, that I need to be able to do that. Because if I'm thinking of a national program, then it's not something that we can just do as an organization. We need the support. We need the political support in all of that. So again, we need advocacy. I set up a meeting with the Minister of Health, and I was gonna do a 10-minute presentation and to sell my case and to sell a vision to him. But because of the pandemic, there are a lot of meetings happening, so I could not see him at the time. But so we need advocacy.
Sure.
For policies that will help with some of these programs. We need the political will to support. And then we need the people to embrace. The people to embrace what we're trying to do, to see the need for it. So a lot of sensitization to create awareness in these communities.
Sure.
So we need that as well. Because even if you go and set up any good program, if people don't welcome your idea, don't value what you're trying to do, they will not embrace it. And
Right.
in community development, you need the people to be involved.
Right.
Because if you're trying to advocate for something, you need the support of the people. Then, we need to be able to meet people who are concerned in policy making, policymakers. We need to be able to confront them, to share this vision with them, and we need the people to support as well.
Right.
Another thing I was thinking of doing also, because of the rate of oral cancer in that part of the world, people are so much into tobacco, smoking, and all of that.
Right.
But if you're trying to address that problem, you need to go to the grassroots, to where they're producing those tobacco. What are the options that we have to give those people to discourage them from growing tobacco? Because that's the source. We want to arrest the problem from the source. What are the options we have for these people?
Sure.
For them to stop growing tobacco, because it's cheap in their communities. So people can easily just lay hands on tobacco and then smoke.
Right.
And the rate of oral cancer is also on the increase. Nobody is screening for those things. So again, policies, awareness,
Right.
people embracing the vision, and then getting all the kind of support that we need in terms of supplies, equipment, all of those things comes together. I think we'll be able to influence the health systems in that part of the world.
Dr. Dumbuya, have you come across any great innovative solutions that have been applied in other countries that you would like to see it applied in Sierra Leone?
Yeah, absolutely. Well, one of the reasons why I'm doing another master's in Healthcare Informatics Administration
Sure.
is because we're talking about telemedicine and teledentistry nowadays. When you have a country like that with almost 3/4 of the population, they living outside of the capital, you need a way to be able to reach out to those people.
Right.
That's why I even get involved into that program, and by next year I should be able to complete that course as well, because we need to be able to reach out to our people. But of course, the logistical problems are there. Many people have access to internet, they don't have computers. The same thing that we're facing in America today, when you ask children to stay at home to do homeschooling. Many people have access to internet, they don't have access to computers. How can we exchange knowledge with In the last 6 months, about 6 people of my relatives, they contacted me from Sierra Leone. They took pictures of their children, and I mean, they were having and toothache. They sent me the pictures, and then they asked me for my opinion. So I was able to, diagnose, based on what I can see from the pictures, which is not an accurate diagnosis, and then make, referral, send them to some of my friends in Sierra Leone for them to access treatment. So imagine somebody who's living outside of the capital.
Yes.
They need that.
Right.
But I know it will take a while for Africa to get to that point, but we need to start thinking about that and working towards that now. Again, because that's one way we were able to reach out to more people access. We're able to give more people access to healthcare and oral health. Other innovative ways, I mean, that we do, um, is working with communities. Because when I was in the mission field in other places in West Africa, I was so much passionate about education.
Mm.
I would go to local churches, Sunday school programs, and talk with children, talk with their leaders. They'll give me time to teach the kids. I will go to the local schools. I even try to establish a curriculum in a couple of schools. I encourage the leadership, to say, hey, look, there's something we call Oral Health Day. It's something they can institute in your school, something that they can establish in your school, that like Oral Health Week, a week where people can just get that awareness in the school. Hand washing. Understand that for any time when you want to brush your teeth, you must wash your hands. So that's another way to prevent other kind of diseases as well. So I was able to try to instill those things in people. So these are other ways that we can do. I mean, people using what they have in their local communities.
Sure.
Like, for example, people use them in chapstick. I don't know how they call it in India or other places, but they have used them a local stick,
Right.
chewing stick, they call it in some part of West Africa.
Right.
It's locally produced. I mean, it has some amount of fluoride content in it.
Right.
Which is good. People use it, to brush their teeth effectively.
Right.
So in case you don't have things like toothbrush, that's something you can use to get effect. But again, the clean water supply.
Right.
How will you be cleaning your teeth without clean water?
Exactly.
Then you're trying to mend one thing, but again, you're exposing yourself to waterborne diseases.
Yes.
So we come back to some of these other logistical things that you don't.
Absolutely. Yeah, we need that kind of a comprehensive solution is quite critical when it comes to oral health.
That's right.
Yeah.
Go ahead,
I think expanding on that piece, one of the visions or one of our goals with this, project and initiative is to shed light on inequities in healthcare and how to address some of those equity and, access issues. You had touched on it as you likened, home virtual schooling in the US versus other places where kids don't even have access to computers or even have access to the internet.
Yeah.
I know one of the ways that, global organizations have helped to at least address those equity gaps is via the use of missions. And you, with your experience with, mercy ships, you are definitely at the forefront of that. One critique of that model, though, is that it's not sustainable or it doesn't force the growth of the local health system. So from your experience and with all of your training and, expertise, what are ways that if you had a magic wand or you were the Minister of Health and you could effect change, what are ways you would work to, address those health inequities and, provide sustainable solutions to those oral healthcare needs?
Like I said, but when I work with messages in those countries in West Africa, then we also used to go to Europe for fundraising. We would tour other countries in Europe, like we go to places like England, Scotland, Holland, all of those places. We spend like 1 week everywhere to raise funds, gather supplies, equipment, donations, because most of the people who will come on board to work, they're volunteers. They're volunteering their time for free. They're even paying money to come to serve on the ship because you have to pay for your feeding and lodging. So these are similar questions that people were asking. How can things be sustained?
Right.
When you just have people coming on missions, it's a stopgap. They will come and then do some work and then leave.
Yeah.
And sometimes they do some surgeries, then there is no post-operative care. They don't coordinate and collaborate with local hospitals as to how they can do follow-up care for those patients. So sometimes when they get into some form of complications, nobody knew what they did. They came,
Right.
did some surgeries, they think that they're doing something good and then they leave. And then the local doctors, they have to carry on with those burdens. How do we plan for post-operative care when people come, they do short-term missions, and then they leave? So those questions were genuine. People were asking, in as much as they're giving donations, but they were asking, how can this work be sustainable? Message if you just go, you do stuff, and then you leave. Okay, during the period of time when we used to be in certain countries, we will stay for like 10 months. If you do a surgery like 1 month at the beginning of your field service, you have plenty of time.
Right.
But when you have to do some surgeries in the last month, how do they follow up with those people? How do they treat post-operative complications and all of that? So missions are good, but again, they're not always sustainable.
Right.
That's one of the reasons why I was there. I was serving in missions, but I always knew that, we only come for a short term and help. We help those who are dying, those who are in dire need of help. That's fine. That's wonderful. Because without that, a lot of people will die. So the timing of it and the different kind of expertise, specialties that will go and help at a particular point in time was important.
Right.
But again, moving forward in terms of sustainability, we need to be able to, the workforce development, we need to be able to get training programs on the ground, ones that will be able to train people to be able to serve their own people. It's their culture. They understand their people, they understand their cultures, how we can train them in a cultural way for them to be able to serve their own communities.
Right.
Then we begin to talk about sustainability. How we can train them, use the local resources that they have. Like, for example, we're planning to build a technical training program in the needy community in northern Sierra Leone. We're trying to build we want to use them in cement and sand to do the foundation, but we want to use a local clay.
Right.
To construct the walls, the bricks, the blocks. We want to use something within their community that is cheaper, that the people have the know-how to do, how to make those bricks so that it will work for them. So we need to be able to develop the workforce. We need to be able to train. Again, we've seen a situation where we train people in Africa, but they move to other places.
Right.
For better pay, for better working conditions, which I don't blame people for that.
Yeah, absolutely. There's a lot of brain drain that happens.
Yeah, so the brain drain is still there. So again, how can we be able to keep those who have been trained
right.
in that part of the world?
Right.
Better working conditions.
Right.
Better pay, competitive pay. Something that will make you see reason to stay.
Right.
Say, hey, look, what the difference, for me, working as a physician in America and in Africa, for example.
Sure.
So that's again come back to government policies.
Right.
and the government, the political will to be able to develop their own work
Definitely.
and keep
Definitely.
them there to be able to do the work. And again, we have to improve education, preventive care, because that's also much more cheaper to do.
Absolutely. Yeah.
Preventive care. I mean, one of
Yeah.
the things that we're also focusing on is because we want to do a cholesterol screening. Most
Right.
people don't understand their cholesterol levels. They don't know the complications of it in terms of cardiovascular diseases.
Right.
People don't know their glucose status. They don't know their sugar levels.
Right.
They don't know that, some don't even know that they are diabetic.
Yeah.
People don't know their HIV and AIDS level, status. So we also want to focus in those things. I mean, preventive care, how we can have, programs that will be able to screen people, breast cancer, things like that. They don't have those
Absolutely.
access to those things for women. How
That
do
is.
they have the equipment to be able to conduct those screenings? That's another
Yeah.
thing. So prevention is one thing that we can focus on also. That's why public health is of great importance in that part of the world. Public health
Absolutely.
approach. People are so overwhelmed with the clinical aspect in those places. They don't even have time for organized public health programs that will focus on education in local languages,
Right.
ones that the people will understand in their communities. Public health education in terms of prevention in their local languages, ones they will understand. Most people are not literate. They
Right.
cannot read and write, but they can understand certain
No.
things. If you are doing
Absolutely.
certain promotion in their local languages that they will be able to understand, it will be of great help to the people.
Definitely.
So these are some of the things I can go on and on and on, but you guys also
No.
explain all of these things, so I don't need
Absolutely.
to, but I just think it's important because I'm also planning on, because I got some publications from the NIH
Okay.
in most of these topics. Now
Okay.
planning on ways to translate them in local languages that people will be able to understand,
Sure.
whether
Sure.
by audio recording and all those things, but for people to understand, just short clips,
Right.
things that we can work with the local communities and see how we'll be able to get people to come to like those community centers where they can learn those things, where they can play those things for them to understand, how they can use the local radio stations,
That is,
because
that
it's
was
one
really
of
well said, Dr. Dumbuya. That was absolutely the kind need of the hour is more public health awareness and the tools that are available in public health to make the prevention cheaper, much cheaper than going through the entire difficult process of treating people aftermath. And in along the vein, could you please discuss a little bit about the foundation that you co-founded with your wife, Shared Blessings Global Outreach Foundation?
Well, yes. Well, as a matter of fact, that's my wife's vision.
Okay.
So then I embraced it. So we co-founded it. It's legally registered here in Maryland.
Okay.
All right. So we started it 2015, 2016.
Okay.
So basically, we've been doing it just out of our own pocket because we believe in being our brothers and sisters keeper. We believe in the fact that we can impact the lives of other people in our own little way.
Sure.
So we are focused on, general medicine. We
Sure.
focus on dentistry. We focus on capacity building. We are focused on, youth empowerment. We also focus on working with children with disabilities. Because in terms of oral health, for example, those children don't have any access to oral health in Sierra Leone. And I will say the same for other parts in West Africa. They don't have any organized dentistry or healthcare program for some of these children. Right. And that's for us is an issue.
Sure.
Now in Sierra Leone, we have over 2,000 children with developmental disabilities. When their parents are even struggling to accept those children. Imagine if you were to go through that, you have a child with some form of disabilities, how to care for that child.
Sure.
You don't even have any organized educational program for them, like we have in this part of the world. So we want to work with those children because they are part of us. They are our children. We want to be able to provide oral health care for them. And not only that, we want to be able to provide general health care for them.
Right.
Because it's all connected. So we're working with those children as well. And then we're also working also with adults as well with disabilities because they don't have access. They are last in the line. They don't even have programs for them.
Yes.
So we also want to focus on that group of people. We also want to focus on them. And of course, we also focus on children with cleft lip and cleft palate as well, which we also try to organize. With the Mercy Shapes, that's one of their specialty too. They used to provide free, surgeries for children with cleft lip and cleft palate. But again, because we don't have any plastic surgeons in the country, no maxillofacial surgeons. So we always have to get surgeons from the West who will go and perform those surgeries. And it's not easy to get those people. So we're also trying to coordinate because another problem again, but when you talk about access, it's not that people don't know, people just don't know where to go to get help. I mean, we see that a lot here in America, in public health, where people, in terms of oral health and other things, people just don't know where to go to get help. When I volunteer with the African American Health Program here, we try to work with immigrants as well because they don't know where to go to get help.
Right.
And women, suckling, mothers, we work with them as well in these programs. We're able to lead them to places where they can go to access, healthcare, cheap healthcare. Sometimes they even access it for free. So we want to create the same for our people. We want to be able to organize these children, go around county-wide and work with the local hospitals, get their contact so that they know where to call. When they have children with cleft lip and cleft palate, it's not for the parent to think that these are evil children. No. They need to understand that they can get help just with, with surgery.
Right.
And of course, those surgeries, as you guys, know, it's a lifelong process or until they turn 18. You have to go through that because it's a multi, specialty, kind of program in terms of, cleft lip and cleft palate. You need that kind of combination.
Right.
You need a nutritionist. You need, plastic surgeons. You need an ENT. You need all of those combinations, speech therapy, and all of those things you need.
Definitely.
To learn from that childhood age onto the turn age 18. So we want to be able to work with those communities, those people that are going through that. Again, like when we said, messages should go, they perform surgeries, and then they leave. But the rehabilitation process going forward, until they turn 18, is not there.
Yeah.
So we're working also with those communities, gathering supplies, equipment, working with local hospitals as well, with credible ones. Because there are people who are out there just to make money out of this. And we are spending out of our own pocket, out of our own little resources.
Yes.
Just because we want to be of help to other people.
Yes.
So that's what Clarity does. We have a membership. We have volunteers from Nigeria. Some of my classmates whom we schooled together.
Wow.
Some did in Europe, some are into pharmacy, some are into engineering and other things. So they are in the mentorship program as well. We have friends from all over the world who are just giving their time just to help in their own little way. It's a young organization, but we're trying to do things by the help of God. So
it's quite inspiring how you have converted your emotions into actions, Dr. Dumbuya. I think Maimuna has a question.
Yes. Yeah, no, that's just piggybacking off what Ashwin just said. You definitely have an inspiring story, and thank you for translating your passion into action. And I think that's what a lot of global health advocates and people who are passionate about healthcare or any cause, for that matter, needs to be able to do, to continue to work on their passions. We all know the world is struggling with the global pandemic COVID, so it would be remiss if we don't ask you about oral health and COVID. So from your experience and based on your expertise, what do you think are some of the considerations for the provision of essential oral health services in the context of COVID? Because I know one of the first things that was done when the lockdown occurred was shutting down like dental services and all, because it figured that any aerosolized procedure would increase the chance of contracting COVID. So in terms of essential oral health services, what are some of those considerations to be able to ensure adequate provision of those services within the context?
Dr. Dumbuya, just to add to it, if you can include both the US as well as low and middle income country,
yes,
in context of both, because you have both the experiences.
Yes, yes. Well, first and foremost, PPE.
Right.
I mean, people need masks. I mean, proper masks. They need gloves. They need goggles. I mean, they need face shields. Those things have to be, provided. They need that. And then also, people have to be pre-screened in terms of temperature checks. Questions like, their exposure to anybody with COVID-19 who has been, medically diagnosed to have COVID-19. So they have to put these preventive measures in place. Provide PPEs for every dental staff. That's one thing that they have to do. Here, the clinic that I work with also from time to time, here at Tacoma Park, we work with children. So because of the aerosol was a concern, so you need open place, and you need less patients to come in.
Right.
And we've seen that here in America, that the issue of people contracting the virus from dental visit has been pretty low.
Okay.
Yeah, because the dental clinics are really very sterile environment, I should say.
Okay.
Because after every patient, you have to, disinfect almost every area that people will touch. So to some extent, I think, because I've been working, so to some extent, it's a very safe environment to work if only people would take those preventive measures. Wear your mask, avoid touching your face. When I work, as a matter of fact, but when I put on my mask, it's only during my lunch break that I remove and change everything. My mask, face shield, everything, non-stop. I don't expose my fingers to my face and touching things.
Right.
So if people can just wear their mask, wear their face shields, use gloves, the proper ways, and also, with their goggles and all of that, I think to some extent, dental clinics are also, kind of safe to work with, to work. And people must also have the confidence to go to access care, to access oral care, because, people are afraid, So, but I want to say to people, because it's low, the rate of that is really low, people contracting COVID-19 from dental visit. It's been really low in America.
Okay.
With all of these preventive measures that have been instituted by the CDC, the Centers for Disease Control and Prevention, people just have to follow those, those precautions. Don't have a lot of patients coming in at one time. If you can't just have one patient at a time, come in, get your treatment, disinfect the area properly, and then bring in the next patient. That's one thing people can do. And then in developing countries, they have to really provide those PPEs. PPEs is highly needed, and people have to get used to that.
Right.
So those are the things I think people should be able to do.
Sure. Dr. Dumbuya, this has been quite an engaging conversation for myself and Maimuna. Before we close, I just want to ask if Maimuna has any final questions.
Yes, Dr. Maimuna.
No questions on my end. Like Ashwin said, we've definitely learned a lot just listening to you. And
yes,
thank you once again for lending your time and expertise to speak with us. And we know that our audience will learn a lot from this. Before I hand it over to you, Ashwin, to close, I know you, excuse me, I know you're very active on LinkedIn, Dr. Dumbuya, but are there other social media platforms that you're active on that we can share those details with our audience just so that they'll be able to contact you?
Yeah, I'm on Instagram. I do Instagram.
okay.
And of course, I'm active on Facebook, but it's mostly on social issues.
Okay.
You know what I do, but I'm on Instagram as well because, yeah, I do Twitter, but not all the time.
Okay.
You know, I do have an account with Twitter. You know, when I did my MPH course in social media and community health. You know, it was one of my favorite courses. So that get me more into those social media tools, in the platforms. You know, so I do have an account with Instagram, and then of course Facebook. You know, which, yeah, my wife also told me that I should do the same because I just stick with LinkedIn, which is a professional network, but I will also do Twitter, and yeah, I can give you my account details for
Absolutely.
Instagram, Twitter, and even Facebook. And
Let us know.
because we can reach more a broader audience with them. Facebook, Twitter,
Definitely.
than just, LinkedIn.
Definitely.
Yeah.
Thank you, Dr. Dumbuya. Speaking to you was such a pleasure, and I'm sure our audience will learn a lot from this conversation, especially how you have been able to convert your emotions into actions, and also the range of topics you have discussed about, and just your life itself, coming from rural Sierra Leone all the way to a developed nation, and now you have established this foundation to give back. I mean, there cannot be anything more inspiring than that. So thank you for your time. We will reach out to you next time when there's an opportunity for any panel discussions or other conversations in our channel.
Okay. Thank you very much, Mr. Ashwin. I mean, it was really nice, discussing these important issues. And I want to thank the two of you for what you're doing, because it's important. And I know that, you definitely make an impact and we continue to make an impact in the lives of people. That's what we should do. We should be able to be our brothers and sisters keepers. Sure. We should be able to do whatever we could in our own little way to be of, help to others in need. So let's continue in doing that. And I thank you both for your time and for everything. Thank you.
Yeah.
Thank you.
Thank
we will stay in touch. Thank you, Dr.
We wish you a Merry Christmas and Happy
Yes, Merry
Holidays
Christmas
also.
too. The two of you. Yes, sure. Thank you.
Likewise.
Thank
Thank
you.
you. Bye.
Bye.